I'm Laura Murphy-Oates, and this is The Full Story.
I mean, it's been brutal. I mean, it's the hardest hit country after the US.
For Sam Jones, The Guardian's Madrid correspondent, it was the intensity with which COVID-19 hit Spain that was most shocking.
You know, it was behind Italy for a while, then it's overtaken Italy, and the pace has just been staggering and sort of unrelenting until now.
In Spain, the death rate has started to fall, which could be the first sign of the country emerging from this devastating time. A time that has brought doctors and nurses who usually work in crisis zones into a country with one of the best healthcare systems in the world.
It's been strange, it's been rather surreal. Before I came to Spain almost 4 years ago, I spent 2 years covering international development, travelling to many different parts of the world during humanitarian crises and the odd war. And I saw a lot of humanitarian groups at work in the field. And suddenly I'm seeing one of the most famous of these groups, Médecins Sans Frontières, MSF, setting up shop, as it were, in Spain, in Madrid and in Barcelona.
Médecins Sans Frontières, which means Doctors Without Borders, works under the motto, first in, last out, sending medical workers to some of the most dangerous places on earth, working on the front line of disasters. Right now, that front line is in Europe. Today, from Liberia to Spain, working on the front line of health disasters. It's Monday, the 27th of April.
A worst-case scenario. Doctors Without Borders has been leading the response with boots on the ground and decades of Ebola fighting experience.
Lewis, Ebola is a disease that is absolutely terrifying. How did it feel for you working in those outbreaks?
On Ebola, I think I felt quite safe, and I will explain you why.
Luis Encinas is a nurse and Médecins Sans Frontières coordinator. He's treated patients in Taliban-ruled Afghanistan, Liberia, the Democratic Republic of Congo, and Sierra Leone as Ebola took hold. He spoke to my colleague Anushka Asthana, editor-at-large for The Guardian and host of the Today in Focus podcast, where this episode first aired.
I'm feeling safe from the very beginning because for me it was very clear. Ebola is a disease that you can be infected by a single drop, a single contact with a body fluid. So at this moment you need to be completely covered. And it was very, very, very clear, very strict protocol.
Did you see anyone die?
A lot. And you wanted to really be there, to give the hand and to be present. But due to this limitation, you need to take a step back and to really discover your coping mechanism. But you wanted to be supportive. So this is a big difficulty.
Lewis understood that as a nurse, his job was not just to treat patients who had contracted this highly contagious disease that could kill half of them, but also to try to ease their suffering in such strict isolation.
Something that came to my mind in Congo last year when I was there, so one of the patients, she said, you know, what is missing for me? It's to have a Bible. So I made the request to the logistician, say, no, we cannot because, all the books will be burned. And I say, what? And what's that? I mean, but we cannot burn the Bible, we cannot, but if this is very important, let's do it.
And can I just kind of make an obvious point, I guess? The places you were going must have felt a million miles away from Spain. Your job as an MSF nurse was to be in other parts of the world.
Yes. And in a certain way, when you come back here, especially from Ebola, you realize that people gave you 10 minutes, 5 minutes to listen to you, but then they have their own life and they have their own business, own problems. And when you were trying to talk about quarantine, about difficulties, about people say, poor people, poor, but that's it.
What did you think when you first heard about COVID-19?
Well, I need to be honest with you. When that happened in China, my first reaction was, that could be another SARS going ahead on Southeastern Asia, no? I start to be a little bit more uncomfortable when this start to affect neighboring countries, but still far away of realizing what could happen in our daily activities and reality. And then I think I started to be very highly concerned and worried when that happened in Italy. At this moment, I say, this is something very, very bad. And you start to talk about that with your friends, with the doctors, nurses, local authorities here. And people say, no, but we are okay. It's under control. And my nightmares starting to become true.
When did that go a step further? When did MSF, usually associated with working in very precarious environments, developing countries, war zones, when did MSF begin to work in Spain and why?
It was, I think it was the 14th of March. MSF already started working in Italy 6-7 days before. The first activity was to offer our knowledge, know-how, not on COVID, because COVID was totally new for us too, but on pandemics or epidemics. That was the first step.
Sam, Lewis remembers realising that COVID-19 was likely to spread quickly and catastrophically in Spain. How quickly did the government come to that realisation?
Well, I think that's a question that governments all over the world are asking themselves and certainly being asked by their own citizens. We've been in lockdown here since the 14th of March, so pretty much a month. There's been some very valid criticism of the government response in that it allowed huge demonstrations, huge marches to go ahead as planned on March the 8th, International Women's Day, which is a huge day in Spain. Now, even at the time, a lot of people were saying, we can see what's going on in Italy. Surely this is not a good idea. And it wasn't until the following weekend, Saturday, the 14th of March, that the government said, right, we are declaring a state of emergency. We're going into lockdown.
Following in the footsteps of its Mediterranean neighbour Italy, Spain has initiated a nationwide lockdown as it grapples with rising cases of coronavirus infections.
What has the impact of the disease been like?
It's left Madrid and the rest of Spain unrecognisable. It is, without resorting to cliches, it's a very buzzy country, Spain, where people do a lot of living on the street. You know, they go out a few times a day to a bar or a cafe. It's very gregarious. It's very sociable. And that's stopped. That's completely stopped. You know, the bird song is very, very loud where I live in Madrid. And I'm fairly close to a motorway. And it's changed, you know, life beyond all recognition. I've spoken to funeral directors, I've spoken to doctors, I've spoken to nurses. I spoke to a woman who works in a care home near Madrid recently, and the stories she had were absolutely heartbreaking and terrifying, of dozens of people dying in the same home. And it is people in those jobs, which are often not very well paid, who are bearing the brunt of this and exposing themselves to infection as well. Ditto people who work in supermarkets and in other food shops. So we really are seeing this big impact on people who are in lower paid jobs, or perhaps, you know, who are more marginalised, like homeless people. It's quite hard to get food to homeless people at this stage. And it's, you know, it is cutting right across everything. But the people at the bottom are the ones who are feeling this most.
Was there a sense of whether and if Spain's healthcare system has been able to cope?
If you'd spoken to any Spaniard before this crisis hit, they probably would have said the same thing, which is that we have one of the best healthcare systems in the world. And that is true. The general standard of healthcare here is excellent. But the important thing to remember in all this is that Spain was really, really, really badly hit by the 2008 financial crisis. That resulted in a lot of austerity, a lot of cuts to frontline health services, particularly in regions in and around Madrid. I spoke to one nurse and she said, even before this hit, if we had a bad flu year, we didn't have enough nurses and we didn't have enough beds. And that is just the flu. And we are dealing with something of an entirely different magnitude here.
Lewis, you were by then working in Spain for MSF. A big shift to what you've done before. In practical terms, what did you start doing?
We start to work in Madrid with a team there. Quickly, we start as well in Barcelona. Here we take the Olympic Hall, becoming hospitals for the moderate and mild COVID patients.
You're basically setting up field hospitals, aren't you? I mean, what does it feel like to be doing that in your home country, in the place which has one of the best health systems in the world?
It's a mix. It's a mix of sadness, of shock to realize that that can happen here. 2 or 3 generations never faced to this. I'm not very patriotic, but at this moment, I wanted to just give my knowledge, sharing my expertise, my support. This is an emergency. We talk about, at a certain moment, 800-900 people dying a day. I mean, I've never been in a place that there was 900 people dying a day for weeks.
You'd never seen it in war zones. You'd never seen it with Ebola. You'd never seen it in any other place.
No. I've seen a lot of people dying, but this is definitely a major crisis, and we need to act on this.
I mean, when you talk about hospitals falling over, in a way, I'm just interested in what that looks like, what that feels like.
It's like a shock. I mean, you were told, and you were growing up in a country that was probably one of the best health models in the world, because the high level of doctors, nursing, university, 4 years, you don't pay anything. That is all free. So that is, you have a universal coverage, and you feel safe. And then you discover that maybe it was a very strong health system, but if you don't anticipate, you discover the vulnerability.
I mean, it's interesting because you said you felt safe when you were treating Ebola. Do you feel that the health workers in Europe, and in particular in Spain, are not getting the same level of protection that you got in those other countries?
To be honest with you, I think that I felt much more safe in Ebola in the middle of the nowhere in DRC, that if I have to work in some hospitals at the very beginning here in Spain with this COVID. Yeah. From the very beginning, there was not a full supportive equipment in order to do their job properly.
And tell me about COVID. What is it about COVID that makes you feel like that?
Well, it's scary because it's, first of all, the discovery of this disease, it's 3 months, 4 months. So it's yesterday. Ebola has more than 40 years history. So first of all is this. Secondly, the fact that medical evidence say that even asymptomatic people could be part of the transmission system put you in a very uncomfortable position, scary position. So what happened is that you realize that the danger can be everywhere. And there is still today in Spain, no clear pictures of what is the reality. Are we talking about 10%, 50% of people, they are protected now because they did the disease, or more or less? So we have no clue because the mass testing is still not the reality in Spain. So this is as well scary.
Next, Sam Jones talks about the long road ahead for Spain.
Sam, this has clearly hit Spain badly, but as we're speaking, the country does appear to have passed the peak. The daily death toll is starting to fall. What has the strategy been, and has it worked?
Well, there's going to be a long post-mortem when it comes to all that. As you say, we seem to have hit peak, touch wood. If we look at the figures for new daily cases in mid-March, it was about a 20%, round about the 20% mark. By the end of March, that was down to 12%. Then it fell to 3%. We're around about 2.1% today. So the number of new cases is definitely coming down. That said, there's question marks over the reliability of some of the figures, and it looks like there are far more cases than we know about. So The general trends are heading in the right direction, and it looks like the confinement, this huge national lockdown, is paying dividends. It looks like it has worked. But there'll still be, a trail, a lag, because obviously there's a fair amount of time from when you get infected and develop symptoms to when perhaps you need to end up in an intensive care unit. And so the country's intensive care units, which are already desperately overstretched and stressed in Madrid, in other big cities, they're expecting a big sting in the tail still to come. Even if the numbers keep coming down, it's going to take a week or two before anything starts improving as far as they're concerned.
And just in terms of comparing what has Spain done to, say, for example, the UK, I mean, how extensive has the lockdown been?
The lockdown has been incredibly strict. I'm sort of slightly baffled from having been in confinement, in lockdown here for over a month with my family, that people in the UK can go out and, have some daily exercise. You're not allowed to do that. If you've got a dog, you're allowed to go and take it for a walk. Otherwise, you are only allowed out of the house if you are a key worker or if you're in one of the professions, the jobs which has seen restrictions lifted or loosened, or if you want to go and buy food or medicine. I do remember, I think it was on the 14th of March, the weekend when the lockdown was introduced here, a nurse got in touch with me, a Spanish nurse, who was terrified by what was going on in the UK at that time. She said, please, I am working on the front line of this. I know the way this is going to go. I know what's going to happen. And I cannot believe that your government is not taking a bigger stand and putting very strict limits on movement. She was actually quite upset and worried about what's happening in the UK, even though she was on the front line here.
The headlines this week suggest that Spain may be taking a tentative step towards easing the lockdown slightly. Is that really what's happening?
I think we've got to be very careful with this. The lockdown is still in place. That has not changed. The temporary measures have been lifted. So some of those in non-essential jobs, in factories and in construction, were allowed to return to work on Monday. Now, that was always intended to be a temporary measure. Apart from that, we are still in full lockdown, as we have been for the past 4 weeks. Now, that said, on Sunday, the Spanish Prime Minister, Pedro Sánchez, hinted that perhaps if the numbers carried on going in the right direction, they might consider some kind of easing in 2 weeks.
Buenas tardes. Estamos a punto de cumplir el primer mes de confinamiento. Hasta ahora, 166.019.
But the language is very, very carefully couched. The message, which is hammered home time and time again, is that we are still in lockdown.
Lewis, you told us before how when you came home from work, people might listen to you for 10 minutes as you tried to explain, say, what you'd experienced in Sierra Leone or Congo. What reaction do people have now?
Oh, a radical change, a completely 180 degrees change. People saying, I realize now what does quarantine mean. I realize now what is exactly the freedom limitation. And we are not in a situation that even I can imaginable compared to Monrovia 2014, where there is a lockdown with no possibility for people to go out and a limitation of food. So here people are still, able to move. But having said that, now people say, I understand. So we need to reflect, and it will be a before and an after of this pandemic, definitely.
Did you ever think that your work with MSF would take you to your home, to Spain?
No, never. I realized 3-4 days when we start to work here, I was there with the president of MSF Spain. We took 2 motorbikes where we put the stickers of MSF. We put our vest of MSF and said, where I am. Did I recognize this city? Completely empty, completely desert. And it was a very strange feeling. I realized that, no, that's happened here. And that's happened to me.
You have worked for years all around the world dealing with major outbreaks. But you, like all of us, have never seen anything like this. What do you think this will do to all societies, but particularly Spanish society?
We need to be together. From the very beginning, if there is Ebola at 10,000 kilometers from your side, or coronavirus in the other opposite place, or another new disease, we need to be together and definitely be able to think differently when this pandemic will be over.
Since this episode first aired, coronavirus cases in Spain have exceeded 200,000, with more than 20,000 deaths. It now has the second most cases in the world, after the US. Lawmakers have extended a state of emergency through to the 9th of May. That's it for today. Thanks to Lewis Encinas and Sam Jones. This episode first aired on Today in Focus and was produced by Mythili with sound design from Nicholas Cox. The executive producers are Nicole Jackson and Phil Maynard. Additional production from Koning. Okay, catch you tomorrow.